This is Jack. He's 62 years old and he owns a business. Jack is worried. He's starting to forget things. He's afraid he's developing the first stages of Alzheimer's disease. Meet Tommy. His parents think that his mood swings might be from ADHD, but they don't want him taking amphetamines on a daily basis at this age. Today, there are 50 million people worldwide diagnosed with Alzheimer's disease. And there are 12 million people worldwide diagnosed with ADHD. In fact, 2 to 3% of the world population has ADHD. 200 million people. And almost half of them are kids. Both ADHD and Alzheimer's disease have something in common. They both have their origin in a small nucleus deep inside the brain. For both of them, there's a big benefit of catching the problem early, before symptoms occur. But today, early detection involves expensive procedures, such as PET scans, or spinal fluid taps, or questionnaires, which are unreliable. The therapies presently available are problematic. We don't want Tommy taking amphetamines every day. We are Braingaze, a digital health company solving some of the biggest problems around neurobiological disorders. Our systems involve very small involuntary eye movements triggered by carefully designed video games. And these eye movements are controlled in a small nucleus, the same part of the brainstem that drive ADHD and Alzheimer's disease. And we and others have published over 20 peer-reviewed papers on this science in leading journals. Numerous experts have clinically validated our findings through trials involving thousands of patients. Our technology is protected by a granted patent, blanket coverage worldwide. And we have solutions for early detection, and we have solutions for digital therapy. Let me tell you how it works. Patients find us through partner clinics or on health platforms online. To do the Braingaze detection test, the patient performs a simple task right on their smartphone. We track their eye movements with the selfie cam and analyze the eye movement patterns. A typical healthy case looks like this. Early pre-symptomatic stages of Alzheimer's disease look like this. And an advanced case of Alzheimer's disease looks like this. Braingaze is more accurate than interviews or scans. And the app automatically generates a brief report in only 5 minutes instead of several hours. Patients that might have Alzheimer's disease or ADHD are referred to a doctor who uses our clinical diagnostics test system to confirm or reject the initial pre-diagnosis. And if the patient has Alzheimer's disease or ADHD, the doctor then prescribes our digital therapy to reduce symptoms. Braingaze gets paid directly by the patient for each online test, and when they use our therapy games to reduce symptoms. We also get paid by the clinic that offers our clinical diagnostic test system, giving us recurring revenue every month. We outperform other options for ADHD and Alzheimer's disease in terms of ease of use and neurobiological relevance. Our digital system delivers improvements, and digital treatments don't have the side effects of drug treatment. My co-founder Hans and I complement each other. I'm the entrepreneur. I founded and scaled several tech companies, 2 of them actually in the mobile healthcare space, and both exited to industry leaders. Hans is the visionary scientist. He has published in the highest ranking journals in neurobiology and is extremely highly regarded by his peers on ResearchGate, which is like the LinkedIn for scientists. The founding team is joined by 2 pharma industry veterans. Ed Vanderlock worked as a product strategist for Glaxo Wellcome and IMS Health. And Ana Lopez is an expert in pharma sales that planned and executed one of the most successful neurology drug launches of Roche in Spain. Our advisory board covers the clinical side of things, and these are all key opinion leaders in their fields that advise governments on national medical protocols. Braingaze has already signed up 25 hospitals and clinics in Europe for our clinical diagnostics testing system, and we started billing them for treatment systems. We hit $200,000 in revenue last year. And we're proud to announce we're closing a distribution deal for early Alzheimer's detection with the Ferrer Group, which has over $500 million in annual pharmaceuticals revenue. We've also signed up a partnership with Ping An Group, the largest health insurance company in the world, to enter the China market. Time to talk about how our digital solutions can replace questionnaires, brain scans, and drugs for ADHD and Alzheimer's.